Good afternoon and welcome to the Committee on Health and Human Services. Would the Secretary please call the roll?
Assemblywoman Gonzalez. Here. Assemblywoman Gorlow. Here. Assemblyman Gray. Here. Assemblyman Hafen. Here. Assemblyman Hibbets. Assemblyman Koenig. Here. Assemblywoman Newby. Here. Assemblyman Nguyen. Here. Assemblyman Ornlicker. Here. Assemblywoman Taylor. Present. Assemblywoman Thomas. Here. Chair Peters.
And I am here. That makes all of us here today. Thank you all so much for being here. Brief housekeeping items. Please just check your cell phones and make sure that they are not, that the sound is off, so we're not interrupting folks as we move through this. We will have public testimony at the end, and as always, you are welcome to send in written testimony before, during, or after the up to 24 hours after the meeting's adjournment. All of the ways to testify or to provide public comment are listed on the agenda. We will move into our work session, which is the only main item on our agenda today. We're going to take things a little bit out of order, starting with Senate Bill 109. Mr. Ashton.
Thank you, Madam Chair. For the record, Patrick Ashton, Research Division, Legislative Council Bureau. Senate Bill 109 authorizes a coroner or medical examiner to release and authorize the removal of a body or body part for transplantation after brain death upon request of a procurement organization if the body or body part is a valid anatomical gift and there is no evidence of the descendant's refusal or an authorized person's objection to it. Amendments. Senator Nguyen is proposing the conceptual amendment attached to the work session document. In summary, the amendment requires a procurement organization under certain circumstances to demonstrate that it has made a reasonable effort to determine whether a person authorized to make an anatomical gift is reasonably available, and provides that the procurement organization has made such a reasonable effort if a search for a person authorized to make an anatomical gift has been underway for at least 12 hours and certain criteria for the search have been fulfilled. Thank you, Chair.
Thank you, Mr. Ashton. Are there any questions? Seeing none, I would entertain a motion to amend and do pass. Second. I have a motion from Assemblyman Nguyen and a second from Assemblywoman Gonzalez. Is there any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay. Please raise your hands. Assemblyman Hafen, Assemblyman Koenig, Assemblyman Hibbets, and Assemblyman Gray. The motion passes. We will move on to Senate Bill 239. Oh, I'm sorry. Assemblywoman Newby, please. 239.
Thank you, Chair Peters. For the record, Patrick Ashton, Research Division, LCB. Senate Bill 239 was heard on April 26. It authorizes a patient who suffers from an incurable and irreversible condition that, according to a reasonable medical judgment, will result in death within 6 months, to self-administer medication that is designed to end the life of the patient. Amendments. There's one amendment attached to the work session document. In summary, the amendment replaces in section 37 the term refer with transition and deletes who is willing and able to provide this information. Thereby, an attending practitioner who is unwilling or unable to provide information concerning the prescription and self-administration of a medication that is designed to end the life of the patient must transition the patient requesting such information to another provider of healthcare. Thank you, Chair.
Thank you. Are there any questions? Seeing none, I would entertain a motion to amend and do pass. I will take that one from Assemblywoman Gorlow and a second from Assemblywoman Gonzalez. Is there any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay? Nay. Please raise your hands. Assemblyman Hafen, Assemblyman Koenig, Assemblyman Hibbets, and Assemblyman Gray. Thank you. The motion passes, and I would assign that to Assemblywoman Gorlow. Thank you. All right, hopping around again, we're going to move to Senate Bill 298.
For the record, Patrick Ashton, Research Division, LCB. Senate Bill 298 prohibits a residential facility for groups from transferring or involuntarily discharging a resident except for certain reasons relating to the resident's condition and the facility's ability to meet the resident's needs if the health or safety of the resident or another resident is endangered, for failure to pay contracted charges, or if the facility ceases to operate. The bill also sets forth certain other provisions and authorizes the imposition of disciplinary action against a residential facility for groups that violates the bill's provisions with certain exceptions. There were no amendments. Thank you, Chair.
Thank you. Are there any questions? Seeing none, I would entertain a motion to do pass. Thank you. I have a motion from Assemblywoman Gorlow and a second from Assemblywoman Taylor. Is there any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay. Raise your hands. Assemblyman Hafen, Assemblyman Koenig, Assemblyman Hibbets, and Assemblyman Gray. That motion passes. And I would assign that to Assemblyman Orentlicker, please.
Thank you, Chair.
Thank you. And we will move to Senate Bill 315, Mr. Ashton.
For the record, Patrick Ashton, Research Division, LCB. SB 315 prescribes certain rights for individuals who are aged or disabled and who are receiving home and community-based waiver services, and certain rights for pupils with disabilities. Amendments. Mr. Jimenez, Chief Policy Deputy, Office of the State Treasurer, proposed the attached amendment to the work session document. In summary, the amendment adds an employee of the state of Nevada as a person who could be selected by an individual who is aged or disabled or a pupil with disabilities to act on the individual's or pupil's behalf. Adds the Nevada Governor's Council on Developmental Disabilities and the Nevada Statewide Independent Living Council to certain sections. Revises certain subsections that a pupil with disabilities has the right to communicate freely using the pupil's preferred language or any other method of communication. Thank you, Chair.
Thank you. Are there any questions? Seeing none, I would entertain a motion to amend and do pass. Thank you, Assemblywoman Taylor, and a second from Assemblywoman Newby. Any discussion on the motion? Seeing none, Assemblyman Nguyen, please go ahead.
Madam Chair, I just want to recognize and thank you, Mr. Jimenez, from the Treasurer's Office for ensuring that the language access piece is amended. So just want to put that on public record. And I know that we all laugh about every time I ask a question is always about language access, but it is very near and dear to the community I represent. So just want to acknowledge the Mr. Jimenez and the sponsor for the bill. Thank you, Chair.
Thank you. Any other discussion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay. Please raise your hands. Assemblyman Hafen and Assemblyman Gray. And the motion passes. I would assign that to Assemblywoman Taylor, please. Thank you. And we will go to Senate Bill 348. Mr. Ashton.
For the record, Patrick Ashton, Research Division, LCB. SB 348 was heard on May 15. It requires a person to obtain the written approval of the director of DHHS before closing or converting a hospital in a county whose population is 100,000 or more into a different type of health facility. The department and its Division of Public and Behavioral Health shall not issue a new license or alter an existing license for conversion to a different type of health facility without such an approval, may take certain disciplinary actions and impose certain civil penalties, and may impose an administrative penalty against a hospital physician group practice or owner of a physician group practice for failing to provide required notice of certain information. Amendments. Senator Doniate proposed the conceptual amendments attached to this work session document. In summary, the amendments in Section 4 replaced subsection 6 concerning administrative penalties with the penalties outlined in items 1A and 1B on the bill page. Amendments 2 through 5 on the bill page make various changes to Section 10.5 and other amendments. Amendment 6 on the bill page revises NRS 449/1818 to authorize DPPH DHHS to impose an administrative penalty of not more than $10,000 daily against any off-campus location of a hospital that violates the current provisions set forth in the statute. Number 7, add the following provisions to NRS 449.1818. 7A, require independent centers for emergency medical care and off-campus locations that provide emergency services to include the national provider or NPI number on each claim for services rendered to a patient. 7b, clarify that an off-campus location that provides emergency services must use its assigned NPI on each claim, and additionally may add the NPI from the hospital that directly or indirectly owns or controls in whole or in part or is affiliated with the off-campus location. The purpose is to allow for the tracking and transfer of patients between facilities of the same hospital. And committee members, I want to note that this item is different than what is provided in the attached conceptual amendment. The bill sponsor clarified this provision after the conceptual amendment was submitted. 7c. Authorize DPBH DHHS to impose an administrative penalty of not more than $5,000 daily against a facility that fails to comply with these provisions. 7d, make items 7a through d effective on January 1st, 2024. And number 8, the final amendment is to add Assemblywoman Gonzalez as co-sponsor. Thank you, Chair.
Thank you. Are there questions? All right. Seeing none, I would entertain a motion to amend and do pass. Assemblywoman Gorlo, do I have a second? Assemblywoman Taylor. Any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay? Please raise your hands. Assemblyman Hafen, Assemblyman Hibbets, and Assemblyman Gray. The motion passes. I would assign that to Assemblywoman Gonzalez. Thank you. All right. Continue our out of order process here. We are going to jump to Senate Bill 146. And so everyone is tracking, there was an amendment that apparently was supposed to come in during the hearing, and we did not receive it until a couple of days ago. So this is many of our first times really seeing this. So take a moment, if you would, to look at that. If you have any questions, we will go into questions here shortly. I'm going to let Mr. Ashton go through the work session document real quick, and then we'll do questions. But I have you on my list. Newbie, Assemblywoman Newbie. Okay. Mr. Ashton.
Thank you, Madam Chair. For the record, Patrick Ashton, Research Division, LCB. SB 146 was heard on May 15th. It prohibits a health carrier from denying a request from a health care provider to enter into a contract to join a provider network established by a health carrier if the provider, for certain reasons, if the provider meets certain terms and conditions as outlined on the bill page. A health carrier may deny a request from a healthcare provider to enter into a provider network contract for certain reasons and can terminate a provider from participating in a network for any grounds authorized under the provider contract. Finally, this bill provides that certain regulations adopted by the State Board of Health must authorize certified nurse midwives to perform physical examinations or obtain a medical history for a patient admitted to a hospital for childbirth. Amendments. So there's a conceptual amendment attached to the work session document, which is on behalf of the Nevada Association of Health Plans. In summary, the amendment applies to Section 4 and revises subsection 1A that a healthcare provider must meet and accept certain terms and conditions for participation in the carrier's network. Subsection 1B, that a healthcare provider must agree that participating in a healthcare network is contingent on continued employment by a school of medicine or school of osteopathic medicine. And subsection 2C, that the health carrier has the sole discretion to determine if accepting the healthcare provider into the network plan would disrupt existing provider network contracts. Thank you, Chair.
All right, questions. Assemblywoman Newby.
Thank you, Madam Chairwoman. I had a question on the Section 4, subsection 2, sub 3, the language that is added as determined by a health carrier in its sole discretion. I was wondering what the meaning of that was, because my reading of it says if there's any reason really that the carrier wouldn't want that particular healthcare provider in, they could just say it's going to disrupt my existing network contracts because it's at their sole discretion. So I was wondering if anybody had any phone-a-friend answers yet on that, or anything they could add to explain that particular change.
All right, we do have someone here from the Nevada Association of Health Plans, Ms. Foley, if you would be able to respond. Please remember to state your name for the record.
Thank you so much, Madam Chair. My name is Helen Foley with Nevada Association of Health Plans. Before I begin on that one question, I wanted to let you know that the document that's in your packet was presented as an amendment from United, from Cynthia Alejandre. And we have corrected that very late today, granted, but if we can replace that, as we decided to take this on as an association and not just singularly as one of the plans. It is identical, it's just who presented it. So it is me. And my answer to you is I don't know the answer to that question. We've tried in the last few minutes since we heard your issue to identify why that was important to them. I would ask that you possibly pass this. If there's any issue, we could address it on the floor. And I do apologize that I don't have a specific answer for why it is totally at the discretion of the carrier.
Thank you, Madam Chairwoman, and thank you, Ms. Foley. That is something that is of concern to me. And as today is a deadline day, I'm okay with it getting out of committee. But I do want to make the record clear, normally we try not to do floor amendments because they're not heard in committee and maybe not as public as others. So I appreciate your thoughts and invitation to keep on working on it and then perhaps have a floor amendment.
Thank you. Thank you. And Madam Chair, Helen Foley, because we have so many bills, we have teams of people that go and work with lawmakers on these. Senator Lang accepted this amendment and felt that it was a friendly amendment, and she had no problem with it. So we would love to explore a little bit further why that language is in there and hopefully satisfy your needs at a later date. Thank you so much.
And folks, I want to clarify, I was notified that we did not receive this amendment as, I think it was yesterday, maybe Wednesday. Do you remember when that came in? Very late, and was surprised that there was an amendment, but I did see the email went to our committee, but there must have been something in the ether that kept it in the internet space because it never actually arrived to anyone's inbox. So nobody on the committee had received this, and then the bill was presented without it, and nobody caught it at that point either. So there have been some technical burdens on this particular amendment, but they did attempt to get that amendment in before the hearing. We just happened to miss it. So I appreciate the intent to work with us on an amendment, a potential floor amendment for this bill, and I will hold you to that if we can move this through the committee today.
We appreciate that very much. Helen Foley for the record.
Ms. Gomez, did you want to add something?
Thank you, Madam Chair. I appreciate the opportunity to come to the table. Reagan Comas with R&R Partners representing Anthem. Just for clarity, that language is standard in our contracts that we write, and so that's why that is in there. But if it is the committee's desire to have that stricken, that is something that we could accept.
I think based on the discussion here today that I would feel more comfortable moving this without that subsection in here. And then if we want to add it back in, if we can have the conversation of what that means and adding it back in, that can be the floor amendment. But moving it out of committee today without that sub would be my preference and what I would accept a motion on today. Any other questions? Yep, Assemblyman Gray, will you turn on your mic though?
Madam Chair, wouldn't it be easier to strike the amendment going forward than trying to add it in on the floor?
No, in this particular case, because of this language and the impact to the bill and policy, it would be easier to add it in to become more restrictive than to try and remove it on the floor. Yep, Assemblywoman Gonzalez.
Thank you so much. As you've stated, we have not had much time to review. We are in a deadline, so I'm definitely comfortable voting this out today, but would like the time to review and discuss one-on-one, and I just wanted to put that on the record. Thank you.
Okay, I'm going to ask Mr. Ashton to go back over the motion for the amendment, just so the record is very clear what we're doing today, and then we will take a motion. Mr. Ashton.
For the record, Patrick Ashton, LCB, so I cannot make any recommendations regarding a motion, but I can just for the record to clarify, Amendment 3 on the bill page is the one that you wish to remove. Is this correct?
That is correct.
So then, okay. Amendment 3 on the bill page, so 1 and 2 on the bill page, that would revise subsection 1A and subsection 1B. In section 4, that is the one that would apply if you were to make a motion like that.
Correct. So I would accept a motion to amend and do pass, accepting the amendments presented to modify section 4, subsection 1A and subsection 1B, not to move subsection 2C amendment. So moved. Thank you. I have a motion from Assemblyman Gray and a second from Assemblywoman Newby. Any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay? A motion passes unanimously. Thank you all. And I would assign that floor statement to Assemblyman Nguyen, please. Thank you, Chair. Thank you. All right. We will move on to Senate Bill 192 next. And Senate Bill 192 has an amendment that we have been working on. So I would, again, just encourage folks to ask questions. If you have any questions regarding the amendment, I will have Mr. Ashton go through the amendments first in the work session document first. Mr. Ashton.
Thank you, Chair Peters. For the record, Patrick Ashton, Research Division, LCB. So, among other changes, Senate Bill 192, which was heard on May 12th, expands the topics that may be discussed in a closed meeting of a board of hospital trustees or a hospital governing board. The bill authorizes also a board of hospital trustees or a hospital governing board to employ dentists and fix their compensation. Amendments. Mr. Van Houweling, CEO of UMC Southern Nevada, proposes the following amendments. Number 1, add to subsection 3 of section 1 a board of trustees of certain county hospital districts that may hold a closed meeting exempt from the provisions of chapter 241 of NRS to discuss certain topics. Amendment 2, add to subsection 3 of section 1 a clarification that nothing in the subsection shall be construed to prohibit the public from obtaining an external report that is otherwise available to the public pursuant to state or federal law. Ms. Gomez, Government Affairs Director, R&R Partners, proposes the following amendments. Number 3. Replace subsection 3D of section 1 that, notwithstanding any other provisions of law, the governing board of any hospital subject to this bill may order that any hearings on the reports of hospital medical audit or quality assurance committees be held in closed session. So members, just to clarify, the second part in number 3 that starts with an applicant or medical staff member, there's a proposal to delete this part and also a change that I just read. It says on your bill page, the board of directors of any hospital. It was requested by UMC to change it to the governing board of any hospital. So the latter part that was deleted from number 3 is because it's kind of redundant with subsection 3C of section 1. And I think that's the explanation so far that I got it. And now going to Amendment 4 on the bill page, Chair Peters proposes to exempt a dentist employed by a county hospital under the provisions of Section 2.5 of this bill from the provisions of subsection 3 of NRS 631.3465. This would allow a county hospital that employs a dentist to accept fees for the dentist services and exercise control over the services offered by the dentist as a standard in an employer-employee relationship. Thank you, Chair.
Thank you, Mr. Ashton. To clarify the amendment proposed in the fourth point there, this is a really conforming change based on the language added regarding hiring of a dentist in the county hospital setting. So we had to go back into the dentist section to modify in there that they had the ability to do that. So it's just conforming change that was requested by legal. And then, okay, so are there any questions on those amendments? Yes, Assemblyman Nguyen, please go ahead.
Thank you, Madam Chair. I just want to make sure I'm on the same page with Mr. Ashton's. So I'm just reading, we have like 4 references to the description of the board. So advisory board, governing board, board of trustee, and then board of directors. So which one are we going with?
So, okay, so I'm looking at the bill.
Madam Chairwoman,
Yes,
if I may.
Assemblywoman Newby.
Just from my experience at Clark County, there's actually the Board of County Commissioners sit as the Board of Trustees for the hospital, and then there's other boards underneath them, but that's at least one of the boards.
We have a call a friend. Ms. Jacob, please go ahead.
Thank you, Madam Chair, and thank you, Assemblywoman Newby. Joanna Jacob, on behalf of Clark County. So, and I think this is because we have to look at the original bill to address Assemblyman Nguyen's question. Yes, it is correct. The structure is that the Board of County Commissioners sits as the Board of Trustees, and then there is a hospital governing board, which is actually does the business of the hospital operations. And part of the intent of this bill was to update the NRS, which previously referred to an advisory board. So that is actually not something that is proposed in the amendment, but was in the bill that was presented at the hearing. So we're changing advisory board to governing board throughout the NRS that governs us here. And then we're making the conforming change in amendment number 3. There was when we were working on this amendment, we were looking at an example from another state, and so we just wanted to catch that and make that conform to governing board, which is the change that we're proposing throughout the bill. So I hope that helps.
So just to be clear, the board of directors is no longer in play.
Correct. Joanna Jacob, for the record, on behalf of Clark County. That was just an inadvertent mistake, I think, when we were looking at the example from the other state assemblyman. So we're just making that change here today. The intent is to replace that with governing board.
To be consistent throughout the
To
document.
be consistent throughout, correct. Thank you.
Great. Thank you, Chair. I just need that clarified. Thank you.
Thank you. Oh, yes, Mr. Robbins.
Eric Robbins, LCB Legal, for the record. I just wanted to clarify because most of this discussion is focused on UMC, which is the only county hospital in the state. To the extent that I am aware, item 1 on the amendment actually deals with county hospital districts, which exist in the rural areas, and they contract for hospital services. So it is to apply these closed meeting provisions to them as well.
Does that raise questions for anyone? We all right? All right. All right. Seeing no other questions, I will take a motion to amend and do pass as discussed and described by staff. Thank you, Assemblyman Wynn and Assemblywoman Newby, for the second. Is there any discussion on the motion? See, Assemblyman Hafen.
Thank you. I do think that this is a good policy. I do have some concerns how another bill that the same presenter brought forward may interact, especially with the technical amendment that you've proposed under number 4, where the hospital would hire the doctors directly. But I hope that other bill dies slowly and painfully, and this passes wonderfully. I genuinely think this is good policy, so I will be voting yes.
Thank you for the comment. Any other discussion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay. That motion passes unanimously with those present. And I think I probably need to include in the record, Assemblywoman Gonzalez has had to step out for another hearing, work session that's going on in the other house. And she will be back, so we will include her when she gets back. All right, we are going to go back to, floor statement to Assemblywoman Thomas, please. Thank you. What? No. Pushing your luck there, sir. It's so good. Okay. All right. We're going to go back to the top and start with Assembly Bill 463. Mr. Ashton.
Thank you, Chair Peters. For the record, Patrick Ashton, Research Division, LCB. AB 463 was heard on April 19th. It transfers the authority and duties to license and regulate certain childcare facilities to DWSS from DPPH, both divisions within DHHS. This bill also modifies the Nevada Early Childhood Advisory Council's membership. Amendments. Please see also attached to the bill page 2 conceptual amendments. So Ms. Loper Machado, agency manager at DWSS DHHS, proposes the following amendment to subsection 2 of section 8. Remove provisions that a local fire agency accredited by a national organization may complete safety inspections, and instead provide that a local fire agency that meets an industry standard accepted by the state fire marshal may secure compliance with standards for safety from fire and other emergencies under certain circumstances. Ms. McDade Williams, Deputy Director DHHS, proposes the next amendments. Number 2, revise Section 1 of NRS 449.0307 so that a designee of the State Fire Marshal may inspect and approve standards for safety from fire for a medical facility, a facility for the dependent, or other licensed facility. The intent is to align these provisions with the proposed amendments to safety inspections of child care facilities by the State Fire Marshal, in Amendment 1, actually. And number 3, Chair Peters proposes the following amendments to Section 5, revise Section 1N to require the governor to appoint a representative of a tribal organization with consideration given to an enrolled member of a Nevada Indian tribe. The intent is to resolve a conflict with similar provisions in Assembly Bill 114. Thank you, Chair Peters.
Thank you, Mr. Ashton. Are there any questions? Seeing none, I would entertain a motion to amend and do pass. From Assemblywoman Taylor, do I have a second?
Second.
Thank you. From Assemblywoman Thomas. Any discussion on the motion? Assemblyman Gray.
Thank you, Madam Chair. I like the policy of moving all the licensing under one agency. I do have reservations. I will vote this out today, but I do have reservations with the Department of Public and Behavioral Health's ability, as we've seen with paramedic licensing specifically, their ability to get licenses out timely. And I just hope this won't affect the ability of standing up new child care centers and keeping existing ones open.
Thank you. Any other discussion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay? The motion passes with those who are here, and I would assign that one to Assemblywoman Thomas. Would you be okay with that one? Yeah?
Thank you, Madam Chair.
You're welcome. We'll move to Senate Bill 43. Mr. Ashton.
Thank you, Madam Chair. For the record, Patrick Ashton, Research Division, LCB. SB 43 was heard on May 12th. It makes various changes to the governance of the Aging and Disability Services Division within DHHS. Among other changes, the bill requires the division to update the strategic plan for persons with disabilities as it determines necessary, mandates the Nevada Commission on Services for Persons with Disabilities to coordinate with the statewide Independent Living Council, allows the Nevada Commission for Persons who are deaf and hard of hearing to develop a statewide plan, and authorizes the governor to appoint officers or employees of a county or city government to the 4 positions of the Nevada Commission on Aging representing a county or city. There were no proposed amendments. Thank you, Chair.
Thank you. Are there any questions? Seeing none, I would entertain a motion to do pass. From Assemblywoman Gorlow and a second from Assemblywoman Newby. Any discussion on the motion? Seeing none, all those in, oh. Thank you. I did have a discussion item I wanted to put on the record. Well, so we had a discussion with the agency regarding the appointment of these 4 positions from local government. And as we've heard in several bills in this presented to this committee, local government is having a hard time getting folks to show up to these commissions and boards, and it makes it difficult for them to do their job for the state of Nevada. So the intent of this bill is to enable employees of those agencies that are impacted by the issues under the provision of the, or purview of the commission. I can't remember if this one's a commission. Council, the council and commission, anyways, that they are able to participate without waiting on the elected official or officer who may not have this as their highest priority. However, the intent would be that employee is able to communicate back to the organization, the local government, on the discussion and decisions being made by these commissions and boards. So I just wanted to put it on the record that that's the intent of this. If it gets to the point where the employee is not being included in conversations at the higher level, we'll have to revisit this. But I think at this time, this enables the commission to create to establish quorum more easily and get things moving in a different way. So I'm hopeful that this modification, at least to the commission's makeup, will make for better policy moving forward. Any other discussion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay. And motion passes with those present. And I would assign that one to Assemblyman Gray, yeah? Okay.
Thank you, Madam Chair.
All right, so we've done 109, 146. We're gonna jump down to SB 161. Mr. Ashton.
Thank you, Madam Chair. For the record, Patrick Ashton, Research Division, LCB. SB 161 was heard on May 10th, and it requires DHHS to allow recipients of benefits under SNAP or WIC to use those benefits to purchase menstrual products. The department must take any action necessary to obtain federal authorization and funding to carry out these provisions. Amendments. Chair Peters proposes to add new provisions authorizing DHHS to establish a program, if money is available, to provide assistance to recipients of benefits provided under a program administered by DHHS to purchase menstrual products, and to apply for and accept gifts, grants, and donations to support such a program. Thank you, Chair.
Thank you, Mr. Ashton. Are there any questions? Seeing none. I would entertain a motion to amend and do pass. I have a motion. I heard Assemblywoman Taylor, and then I heard someone from my Assemblyman Gray. Any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay. The motion passes with those present, and I would assign that to Assemblywoman Gorlow.
Thank you very much, Chair.
You are very welcome. Okay, we have a couple more to get through. Thanks, folks. We will jump down to SB 280. Mr. Ashton.
Thank you, Chair Peters. For the record, Patrick Ashton, Research Division, LCB. SB 280 was heard on May 8th. It requires a hospital to provide for the insertion of long-acting reversible contraception immediately after childbirth, if requested by a patient giving birth. Certain hospitals and providers are exempt from this requirement, and this bill prohibits certain public and private insurers from refusing to cover the insertion of such contraception immediately after childbirth, and restricts the amount that a healthcare provider or hospital may charge an insurer for the service and associated testing. Amendments. Senator Wynne proposes to amend subsection 5A of section 1 by adding contraceptive injection to the definition of long-acting reversible contraception. Additionally, make conforming changes throughout the bill to provide for the insertion or injection of long-acting reversible contraception. Thank you, Chair.
Thank you, Mr. Ashton. Are there any questions? Seeing none, I'd entertain a motion to amend and do pass. From Assemblyman Wynne and a second from Assemblywoman Gorlow. Is there any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay. The motion passes with those present, and I would assign that one to Assemblywoman Newby. All right, I think this is our last one, folks. We'll move on to Senate Bill 317. Mr. Ashton.
Thank you, Madam Chair. For the record, Patrick Ashton, Research Division, LCB. SB 317 was heard on May 10th. It authorizes a provider of homeless services to allow a person experiencing homelessness to use of the provider's address as a temporary mailing address for up to 180 days if the person is a Nevada resident receiving services from the provider. Amendments. Chair Peters proposes to amend Section 7 by adding an authorization for a person in crisis who is receiving services from a provider of homeless services but is not a Nevada resident to use the address of the provider of homeless services if the provider of homeless services determines that the person intends to reside in the state for at least 6 months. Thank you, Chair.
Are there any questions? Seeing none, I would entertain a motion to amend and do pass. I have one from Assemblywoman Gorlow and a second from Assemblyman Wynne. Any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay. The motion passes with those present, and I would assign that floor statement to Assemblyman Wynne.
Thank you, Chair.
Okay. Okay, so that takes us to the end of our work session today, which was our only action item on the agenda, and we will move into our last agenda item before we recess. We will take public comment. We are asking that public comment be limited to 2 minutes to ensure there's a fair opportunity for folks to share today. We will start here in our physical locations and then go to the phones. Is there anybody in the Carson City or our Las Vegas locations that would like to provide public comment today? Seeing no one approach the desks, go to the phones. BPS, is there anyone on the public line to provide public comment today?
Chair, the public line is open and working, but there are no callers at this time.
Thank you. We will close public comment. That brings us to the end of our planned agenda for the day. Please keep your afternoons open and keep your attachés watching your emails if you can. We are going to go into recess in case something comes up, and then we will adjourn on the floor otherwise. So with that, we are in recess.